Asian College of Physicians. I'd also like to introduce Dr. Martyn Lloyd-Jones. Martyn is an addiction medicine specialist who has worked in the alcohol and drug field for over 20 years. He has worked in leadership roles in private practice settings as well as in public hospital and community clinics, and is actively involved in medical education and clinical research. He is a passionate advocate for evidence-based interventions and has a particular interest in decreasing the stigma of substance use and developing new treatment paradigms for individuals with addictive disorders. And I understand that today that they'll be talking about public health programme challenges, pill testing at music festivals. So if you could join me in welcoming our two presenters.
So this is a very informal session, and we would both enjoy it if you would participate. I know it's the first session after lunch, so that's a challenge for all of us, but we'll do our best. Firstly, I want to start with a straw poll. So I'd like people to put their hands up if they are not in favour of pill testing or drug testing. Okay, that sounds pretty good. That's a unanimous vote. I can go home then. I don't need to be hanging on.
We'll ask the same question at the end.
So it's, I think, obviously a bunch of public health physicians or potential physicians, we would expect to be on side with this, but within the medical fraternity, there is quite a lot of disagreement. So not everyone is of the opinion that we should test pills for people to take at music festivals. And I think it's an interesting dilemma when within the profession we're trying to push for something which we believe is an appropriate approach to enhancing harmonisation and a bunch of other things, destigmatising as well. And some of our profession are actually opposed to it. So, you know, it's quite a challenge. So we don't have to just deal with politicians and police and local governments. We also have to get our colleagues on side.
Can I?
Yes.
Can you ask the same question, but who's not decided yet as to whether
Of course I would, thank you. So who is undecided about whether we should do pill testing or not? That's good. There's 3 honest people in the room, maybe 4. Come on. That's great.
Why don't we actually take account then that's something that that's probably a more sensitive marker, isn't it? So how many people are undecided? Maybe we should pose the question a little bit more precisely. How many people, because what we're proposing, what Martyn and I proposed, is not pill testing, but a careful trial of pill testing. So are you okay if we put that proposition? How many people here would favour a careful trial of pill testing? How many people here would be opposed? Sorry, I shouldn't say careful because that biases it. How many people here would be opposed to a trial of pill testing in Australia? So 1. Okay, all right, thank you.
And one more question. Does anyone think we do not need a trial based on the evidence that currently exists?
Does anyone feel that the evidence is sufficient to proceed with pill testing without a trial? So there's 1 person, 2, 3, 4. Okay, thank you.
So that's really helpful because it does allow us to understand that, you know, this is not a straightforward matter, even with people who are generally in favour in broad terms. It's clearly not straightforward. And I think it's really important. So I'm not a public health expert. I did actually do a little bit of reading before coming along today to understand a bit more about public health. And of course, one of the challenges is working out who the partnerships we need to have should be with. So clearly our profession are one group, and then other relevant players and politicians clearly are relevant. In this case, if we're talking about drug safety testing or pill testing, then the local police, obviously the conveners of the festivals, if we're talking about pill testing at festivals, or if we're talking about other venues, then we'd need to involve the people there. And also you want to know that the individuals attending are interested in the process. So there's a bunch of people you need to try and collaborate with. You also need to have I guess, an innovative approach to addressing the issue, and you need to have sufficient technology to be able to do what you are wanting to do. Not so much what is being claimed, but what you actually want to do. And you need to have an effective communication strategy, which is, again, challenging because you've got to be communicating with a bunch of different people at a bunch of different levels. And then you also have to have a good I guess, self-assessment package. So you've got to be determining how we're going to monitor, and this is why Paul and I are calling for a trial, not just innovating and going ahead, because I think there is some quite reasonable low-level evidence for benefit, but at the same time, some people are overstating the gains of pill testing. So people are saying this will save lives. And I think we might like to think that's the case, and it logically should be. If pill testing was widely available at every music festival throughout Australia, it is highly likely, for a whole bunch of reasons, that some people's lives would be saved. But actually, the benefit is much bigger than that, and you can't be sure that you will save lives. Because to save lives, a whole bunch of things has to happen. Number one, the person taking the substance has to have their substance tested. That substance has to be tested in a way such that the information obtained is not just accurate, but able to inform a change in behavior if there is something in the substance that you didn't want to be in the substance. So there's a whole bunch of things that need to follow for that claim to work. So it's much more important, I think, to recognise the other benefits of drug safety testing or drug testing, pill testing, call it what you will. And that is that this is an opportunity to engage people who don't otherwise engage with health in a discussion around their health, in a discussion around their substance use, whilst at no time approving or at least condoning their substance use. What we're able to do is provide a message. And the message is always going to be that if you want to be safe, you're advised not to take the substance. But it's a recognition that the individual has every intention of taking a substance. And so we have to then give information about, have we been able to demonstrate evidence of harm? So just alluding to the more recent Groove in the Mood festival, there were a number of people, I think on about 5 occasions, who had N-ethylpentalone identified in the pills that they produce or the powders they produce for testing. N-ethylpentalone is a very toxic substance. It's not a good thing to ingest in any quantity. So the advice was given, do not take this, it is very toxic and is likely to kill you. And as a consequence, some of the people with the pills changed their intentions. I don't think anyone took those pills, but
they said that all of the people,
yes,
in whose pills N-ethylpentalone was identified, disposed of them.
And there was a group of people, I think, who said they had an intention to get rid of their pills. Okay. So I think, yeah, nobody took those pills as far as we know, and there's clearly we would have probably found out because they'd have ended up in hospital. But the evidence from testing at festivals is that a proportion of people, when told there is something toxic in their pills, will either dispose of them there and then, or will undertake to dispose of them. But not everyone does that. So I think it's important to understand that the message is, human behaviour is such that humans may decide to take a tiny bit of the pill to see what happens. They may not take any of it. So it is not straightforward to, if you like, introduce something like pill testing and use the argument this will stop people dying at music festivals. Because if we do that, it's a bit like saying if you have a medically supervised injecting facility, people will not die of heroin overdoses in a medically supervised injecting facility. We can't make that claim. Thus far throughout the world, there has been no recorded death in an injecting facility from an opioid overdose. But there will be one day. So if we use the argument that MSIFs prevent people dying, we've got to be very, very clear about what we mean by that, because we will not stop everyone dying of overdoses. So I think the language used, again, in terms of the claims that we might want to make from any public health intervention has to be very carefully thought out and worded. Otherwise, we run the risk of making claims that can be easily proven to be false, and that can take away any of the benefit that the intervention may have had, because politically it will also be seen to be unacceptable. So I think it's very challenging. And I think, Paul and I, when we got involved in this, there was an opportune moment, which I guess is the other key to any public health intervention in some ways, is having an opportune moment to do something. And one of the challenges that exists sometimes is finding that moment and being able to do something at the same time not overstating the case. And I think the statement that we made in the initial discussion in the conversation was around, it is now time for this process to occur. And that was then met with significant political, I guess, lack of interest. And as a consequence of that, Paul and I and the head of the chapter, the head of the, I'm getting this wrong now, Faculty of Public Health, I wrote a letter to the territory and state premiers, urging them to consider trials of pill testing throughout Australia. So we weren't saying introduce pill testing, we were saying we support a trial of pill testing. So does anyone have any either questions about the sort of whole process or questions about how one might go about enacting a change, or what some of the challenges might be?
Yeah. Can I just make a couple of comments? So maybe I'll just add a couple of things to what Martyn just said. Our article in The Conversation had 25,500 downloads, which was interesting. That's quite a lot, and clearly it hit a spot in terms of current interest about this issue. I think it's important, just for people who are not familiar with this, to outline what the key arguments are, and you're probably more familiar than we are with them. But the arguments in favour of pill testing are basically harm minimisation ones, that many of the deaths occur from lack of information, lack of knowledge, contamination, or lack of knowledge about the concentrations, because the purities can vary a lot. Music festivals are places where it's well established that there are lots of people who take illicit substances. That's even why many people go, and there are lots of deaths. There are lots of adverse events that occur, including some deaths. And so the argument is, if we provided adequate information, which includes counselling, but also actual testing of substances, then people would be informed to make decisions about safer behaviour. That's kind of the gist of it. And you know, because it's bread and butter for you, about harm minimisation, and how the argument about harm minimisation is that it doesn't involve acquiescence or approval for illegal behaviours, but rather it seeks to change behaviours into healthier or more productive courses of action. Against pill testing, there are probably three main arguments, I think. One is that it sends a message of acquiescence about illegal substance taking, and that's a bad thing in itself. It's like saying it's okay, we approve that the society as a whole is giving the green light for taking these substances. The second is that the information is not sufficiently reliable to enable people to make life or death decisions, that there will always be an element of uncertainty, and particularly if it's done on site and so on, that it lacks sufficient scientific accuracy. And I'll ask Martyn to comment on that, because that's within his expertise. And then the third argument is that it puts the police in an invidious and compromised position. So because here you have a caravan in a paddock, and there are people walking towards it who are implicitly admitting that they're in possession of illegal substances, and that somehow or other the police are standing around watching this happening, and that on the other hand, in the rest of the festival, they're supposed to be going around raiding people, using their sniffer dogs, arresting people, whatever. And that's a serious issue. The police really are concerned, and it's actually for that main reason that the government, at least in Victoria, is not moving ahead, because the police are very concerned that they would be compromised, that there are mixed messages being sent. And they've even said, you know, what if we see the person walking towards the caravan and we agree that this is a safe no-go area, and then 10 minutes later we see them, at the stage, sort of raving. Does that mean we're not allowed to go up and arrest them or search them or whatever? And you can see there's a serious issue there, and there would have to be some sort of mechanism that was thought out to consider that. So they're kind of the arguments for and against, and I think it's important to consider them seriously, but also consider what the kind of public or policy impact of that might be. And within the current setting in Victoria, there's another issue which I think is inhibiting the Victorian government from moving forward. And, you know, Daniel Andrews proudly says that this is the most progressive government in Australia. and maybe it has been in relation to voluntary assisted dying legislation, which comes into effect on Wednesday, with the and there's a safe injecting room in Richmond. But it's actually the safe injecting room in Richmond which is the sticking point at the moment, because there's been so much publicity about the negative effect in the local community. And that's a really big controversial issue that's got everyone walking on eggshells at the moment, and the government saying we're not going to touch pill testing because there's so much nervousness in this area. You know, we've stuck our necks out with these other things. We don't have to do that in this case. So the question about how you would actually go about assisting the police and the government and other public authorities in changing policy in a constructive way is one that we're battling with here. So, question and answers. Now, we've only got one microphone here and one there, and we thought we'd try, if you're able to shout out and everyone can hear, that'll be fine. If not, I'll run around with the mic.
I just wanted to know what the procedure is. So people are not obviously being searched or anything. They're asked to voluntarily show the pills they've got. Like, how does it work?
So firstly, the issue is that these facilities are set up within a health facility, so that if you're actually approaching it or going into it, nobody knows actually why you're going. Now, they might say, oh, we reckon you're going to have your drugs tested, but there is actually, it's a health facility, and when you go in and the entrance, beyond the entrance is obscured, you can go left or right if you like, and left is to go and see the nurse or the doctor, and right is to go and have your pills tested. So it's once you're in the facility, that is the only time, if you like, that it could be worked out what stream you're going to. So that is very important because, as Paul has mentioned, you don't want people watching everyone going in and going, okay, they're all using drugs, we'll keep an eye on them and then we'll go and catch them later. That's just crazy. And there is, you know, some evidence that policing at festivals does cause that sort of harm, because people will often swallow their pills before they go in, so the sniffer dog doesn't get them. And that's when overdoses may happen. So, you know, there's a whole bunch of reasons why drug surveillance is actually quite problematic if it's applied in areas where high rates of drug consumption occur. So at music festivals, the rates of consumption amongst young people are between 50% and about 20%. So the minimum is going to be 1 in 5, perhaps something in between that and 1 in 2. So clearly a high level of drug use is happening. So we have to just accept that. That's not going to change. Prohibition hasn't worked. Police dogs, policing, etc. doesn't work. So we then must have a different approach. So coming back to the process, somebody would then approach, so there's a desk here, a couple of desks, nice people sitting behind it wearing lab coats. No, that's exaggeration, but there is some machinery, and I'll talk about that in a minute. People will be invited to hand over some of their drugs. So one of the issues is around what you do when you've received that drug, because you can't give it back. So once you, as the provider of services to this group of people, receive substances, you cannot give it back to them. You've got two options. Currently in Australia, the only options that exist are it gets destroyed once it's been tested. But in other parts of the world, sometimes those drugs, once they've been tested, get put aside and then get tested again in a sort of more rigorous manner, which helps in terms of drug surveillance and knowing what's going on. So that's actually a more useful thing. But typically, it gets shoved in a container full of bleach or something and it's gone forever. So a sample is handed over, and that's a sample of usually powder or pill. Ideally, you would receive a whole pill, say it's supposedly an ecstasy pill, but often you'll get a scraping off that pill.
It could be with sandpaper or something.
Yeah, so individuals often when they're buying drugs at music festivals, just in case you don't know this, some of you might, will club together and a bunch of them will buy a bunch of pills, and then they will surrender a pill or a quarter of a pill or something like that for testing. Okay, so there's an inherent weakness there in that these pills are not necessarily made to, you know, Bayer pharmaceutical standards, and therefore what's in one quadrant of the pill may not quite represent what's in the other 3/4. But in reality, it's probably not terrible, but it's not perfect. And that's where one area of criticism kind of arises, that you're telling people about the bit you've tested that then is being discarded, not the bit they're going to ingest. And one has to accept that is a weakness within the system. So this gets handed over. The individuals are then given a number, usually, so it'll be a code that is their number. So it's not, you know, nobody's shouting out, John Smith, your pill has been tested, come to the tent. There will be a number which they can either access by coming back later, or it can be accessed through the internet. Depends on what system is up and running.
They'll be asked to sign a disclaimer.
Yeah, so they'll be given information saying, we would advise you not to take pills if you want to stay safe. So that the information is always don't take it, but and they'll sign a disclaimer saying they understand all that, but nonetheless, thank you, and that's fine, and that's requirement. It's appropriate to have a legal disclaimer. In reality, it's probably fairly meaningless.
From an ethical point of view, which is one of my things, as you know, there could be an objection that if they're intoxicated when they sign the disclaimer, that may not be valid.
So, there are some challenges. And of course, the pills that are being taken are not just being taken by the individual. So often people come in a group of 3, 4 or 5 for testing, and one of them will hand over the pill and then they'll be spoken to, so they'll all be given information at the same time. And snowballing of information is very common at music festivals, in particular in relation to what's in the substance. So we'll come back to that. So a pill goes off, it then gets tested, and it gets tested in a number of ways. Typically in Australia at least 3 ways, but in other parts of the world often at least 4. So there will be what's called FTIR, which is infrared spectroscopy. There will be a reagent test done, and there may be something called mass loss analysis done. So, and the additional test which is missing, as you'll be aware, is GCMS. So GCMS can be done in a field setting nowadays. The machines cost about $50,000 or a bit more, but they are available. So there's been trials of on-site field testing GCMS in the UK, where the Loop has been using some of that technology. So it does exist. You can do very high quality testing within about 30 minutes. Clearly, you're not going to get perfect results. So if you're using something like a reagent test, you're testing for a number of different substances. You might get 50 or so things that you're looking for, and you'll get a coloured response. And that will give you some idea. Is there MDMA in this? Is the ethyl pentalone? Are there things you don't want, and are some of the things you might want? FTIR has a range of about, I think there's about 50 or 60 or maybe 70,000 drugs identified in their data set. So you're basically comparing the substance you're testing against an enormous data set, which is uploaded in real time constantly around the world. So there's if you like, a central repository of data. So it's a very good way of looking at chemicals, whether they've got the chemical signature, if you like, of something that's known, ecstasy, something that's known but toxic, or something that's unknown. And of course, if the sample you test has got unknowns in it, then your message to the individual is there is unknown stuff in there. We don't know what it is. We advise you not to take this. So it's an even more stronger emphasis. Don't take this because we can't tell you what's in it. Equally, if something like ecstasy comes up, okay, one of the questions you might want answered is how potent is that pill? Because we know that ecstasy pills can vary from 20% to 80%. And if you're used to taking a bit of ecstasy and you take a pill that's got 20% in, maybe that's okay for you. But if you take a pill that's got a much higher dose of ecstasy in it, that could be toxic. So,
especially in addition to alcohol, which is very common.
Sure. And the other thing about these people attending music festivals is a lot of them are novice users. So they're not hardened users using 3 times a week or something like that. They might use once or twice a year. And so individuals' susceptibility to the chemicals they're taking may be unknown for them. So it's very, very important, ideally, to be able to say, well, this is actually a very potent pill. So if you are going to take it, don't take the whole pill. For heaven's sake, take a small amount. Now, there are some techniques that do allow you to do some assessment of the if you like, amount of MDMA in a particular pill. But you do need a certain amount. So you need at least 5% of the tested product present in order to get a signature anyway. So there's inconsistencies. Yeah. So there's inconsistencies in the technique. And this is why there's been criticism by some of our colleagues, particularly toxicologists, about whether we should be giving information out or not, because the information we give out has to be less than perfect. I think from a public health perspective, you might find it easier to understand that giving limited information is better than giving no information. I certainly feel from the harmonization point of view, it's a far better stance to have to say, look, we don't have complete information, but we do have some. And that's the information we should impart. Coming back to the question, so how that process then rolls out is the testing is done, it's completed with usually in about 30 minutes, and people, when asked, have said they're willing to wait up to an hour to get their results, so that's pretty good. They then either come back to the tent or they can look up on a website to get the information about that particular pill. Yes?
Just in reference to what you're saying, in reference to the amount of information we can give is proportion of it, are there any unknown unknowns? So like, because if we're only giving some of the information, we don't know all the potential information, is there any chance that we could be unknown risk towards the person taking the...
Yeah, so I think you know, if you identify what's in the pill and say there's 3 or 4, there's going to be a load of excipients too. So there's usually chalk, you know, concrete, whatever. There's a whole bunch of stuff that you might find in there. But if it's sold as an ecstasy pill and it has some ecstasy in it and it doesn't appear to have any other toxic substances in it, so you identify ecstasy, you identify chalk powder, bicarb, whatever it happens to be, then you can say that from the purposes of this testing, the pill contains that, that, and that. If there are unknowns in it, then I think you just have to state there are unknowns, or you would state there are unknowns in it, and we cannot determine whether those unknowns are toxic or not. Therefore, our advice has to be, you should not take this. Yes?
You mentioned you can some information is better than no information, but at the same time, the illusion that you can provide information may encourage people to bring drugs and say, hey, it's going to be tested, so I'll give it a go. Or again, people who may have feared police intervention may think, okay, I'll take drugs because I can get it tested and I'll be okay.
So could I just say, that raises the question about how you actually interact with the people and what kind of information you give to them. One of the points that Martyn and I have stressed is that a key and absolutely necessary component of pill testing is that it's linked to a counselling process, so that everyone who undergoes pill testing agrees to undertake some sort of counselling process. And in a sense, from my personal point of view, I think that's probably as important as the testing itself.
So the latter part of your question I think is very relevant, but there isn't evidence to show that pill testing increases substance use. And that's very, very important, because I quite agree that, you know, it might seem intuitive that if people can know exactly what's in the pill, the small group of people who might not take a pill because they're worried about what might be in it might take a pill because they believe it can be tested effectively. So I think that's a concern, but there is no evidence for that occurring. The other issue, I think, though, is that... Sorry, I'm getting lost. So can you just rephrase your first bit of the question again?
Well, the deterrent of police as well, that sure we can estimate how many people are bringing drugs, but could it have been more if police presence wasn't there?
So I think you know, drug policy, which is, I guess, where that's coming, does changing drug policy to decriminalise substance use, if you like, increase use. And this is a really tricky point. So I think what we're saying, I mean, we know that people going to music festivals, there's a particular group, so let's just talk about them for a minute. A high proportion of them are going there and they're going to use drugs. Some of them are going there so they can use drugs because they perceive it's a safer place to do it, perhaps, or where it's just normative behaviour. So I think we have to acknowledge that population, by and large, is intending to use. Now, undoubtedly, there'll be a very small number of people who might decide to use because it's perceived as if it's not being policed in the same way. Say you go into the festival, once you're inside the gate, it's okay, there are no police looking out for you. They'll still be looking out for dealers. You're not going to stop the police actually being there. But if they're willing to condone or at least accept ongoing substance use and not be chasing people down for using as opposed to dealing, then it is possible that a small number of people will use who otherwise wouldn't have done. Sure. But I think and this is always going to be a trade-off of benefits versus harms. I think we know availability is really all when it comes to substance use. So in relation to alcohol, tobacco, anything else, it's availability. The number of outlets, how long they're open for, who's allowed to buy it, etc. So there is that. We haven't seen very significant changes in substance use in areas of the world where drug use has been decriminalised. So we can look at a whole bunch of places outside of America and Canada, for the moment. We're not going to talk about cannabis, and say the Netherlands, where cannabis use is not a criminal act. You can go into a cafe and smoke cannabis and use cannabis. That did not lead to an increase in cannabis use. In fact, for their societies, socially, it's not really acceptable to use cannabis, even though plenty of people do. So I think there are a bunch of other factors that influence whether people are going to use or not, outside of whether it's just policed. And I think that's a challenge, because we don't have the answer for Australia.
But with the current proposals in Australia for pill testing or pill testing trials, they're not generally linked to proposals for decriminalisation. So it's usually assumed that normal police practices would continue to occur. So the two are sort of disconnected. Some people do argue in favour of decriminalisation, but we haven't. We've said we would support or allow existing law enforcement processes to continue unchanged, and this would just be an addition. So the two arguments are really separate. I guess the other point about pill testing's been available in one form or another around the world since the early 1990s, and there's about 20 jurisdictions, mostly in Europe, where these have been undertaken. So there's a bit of evidence, but on the whole, it's not very good evidence. And it's not very good evidence partly because it's illegal activity, even where there are sort of gentlemen's agreements with the police. So no one has really undertaken properly rigorous studies, and there are no outcome studies. There are all sorts of tricky things with the law, such as that it's illegal for the pill tester to come into contact with the substance. So in Belgium and Spain, they have sort of weird systems where the person delivering the substance grates them on a with piece of sandpaper, as I said before, or something else, and then the pill tester uses gloves and kind of has a no-touch technique, because if there was any sort of physical contact, that they would then be in contravention of the law. It all sounds a bit silly, and it probably wouldn't apply in Australia, where it would be worse in Australia because the law is couched so broadly that the pill tester, even under those circumstances, could potentially be judged to be criminally liable or in breach of the criminal legislation. So these are tricky things that need to be thought through. There'd probably need to be some sort of legislative adjustment in order to enable this sort of testing to go forth in a legal way.
Who pays for the testing?
So that's a good question, because if you're thinking about a public health intervention, it's only for a very small number of people in the population. Is that reasonable that the public purse pays for it? I think the answer to that is, in all bar, I think, 2 countries, it is a private philanthropic activity. In the UK, just recently, the Loop have, I think, got a trial for 12 months or so where the government are actually funding some of their work. So this is just a new thing. And there is one other country, and I think it's the Netherlands, but I could be wrong, where it's also part of their stated drug policy. So there is funding from the government. Mostly it's philanthropic efforts or private donations. And a lot of the Loop's funding from the UK is of that sort. Of course, if you're talking about a music festival, the cost to the music festival conveners of policing is enormous. Now, I heard a figure for the New South Wales and Queensland festivals of 500 million for policing. Now, I don't know if that's true, and I'm not, so don't quote me for heaven's sake, but it's clearly a very large amount of money. Pill testing doesn't cost very much at all, really. In those sorts of terms, it's trivial. So the reality is, there is no reason, I would have thought, in Australia, why people who are putting on music festivals could not fund that.
Groove and the Moo crowdfunded the cost. I'm not sure how much they raised, but they were able to pay for it through that mechanism. I guess another point to be made, though, is that not all music festivals are the same. I don't know, how many people here go to music festivals? Okay, so you know much more about this than I do. I only know about it from asking my children. So some music festivals are places where young people in, university students or whatever in their early 20s go, and they basically take ecstasy, and they're very careful, they're reasonably well informed, and they're very receptive to this. They're really positive about it. But there are other places that might involve teenagers who are going there precisely to take risks, in which case they may not be as open to the messages. So it can't be assumed that this is a panacea. It might require very specific targeting, and it could be that that's what the testing shows, that there are certain settings in which this is effective and others where we're wasting our time and money, or maybe even doing harm. And that's why we need to refine our knowledge and information in order to refine the strategies that we undertake.
May I ask, because I do not know anything about this particular aspect, I presume that involving people in counselling and engaging people, the carrot for that is very much having the testing. But so I doubt uptake would be particularly high otherwise, but it seems to me very much, that it would be ethical to be at the very least providing opportunities for drug-related counselling. So I wonder what actually is the current state of that behaviour. And I guess any comparison would need to be in relation to where actual counselling is provided at a bare minimum, because otherwise that's somewhat unethical.
So the nature of counselling typically is a sort of harm minimisation type approach, but with the opportunity to link into AOD services externally. So there are usually, and I can't speak for Groove in the Mood because I'm not sure exactly what that staff profile was, but certainly at the Loop there are usually there are qualified health practitioners with AOD experience who are able, if somebody said, oh look, I'm concerned about so-and-so substance use or my substance use, who could provide appropriate counselling there and then. But most of the if you like, expert counselling about substance use is provided externally. So it's creating those links. Bearing in mind, these are not people who tend to talk to their doctors or AOD services about their substance use. So this is, if you like, it's a bit like the medically supervised injecting facility, where people are encouraged, if they're concerned about substance use, to seek help. So the MSIC has made lots and lots of referrals to people who are presenting there who actually want to get onto ORT or to have Hep C treatment or to talk about other health issues. So I think some of the benefit, as Paul alluded to earlier, is not about talking about the substance use there and then. It's actually engaging a population who's currently not engaged at a health level at all.
For festivals that do not currently have pill testing, what sort of counselling might be available in those events?
I'm not aware. Sorry, I don't know.
It's and I'm not aware either, but it's my understanding that there are counselling services that are routinely offered as part of the package, but I don't know what the details are. It's a really important question.
Question probably follows on from that a bit around the communication, specifically around the results of the testing. I don't know whether there's evidence available from, internationally, that it seems like it would need to be quite nuanced, and what gets traction and what's most successful in terms of changing people's behaviour, particularly, I suppose, if it's being delivered electronically rather than face-to-face, and how you sort of come up with crafting those messages as well.
So how it's delivered will depend on the particular environment. So various places will do it differently. I think in Australia it's always been face-to-face, but there is the additional benefit, of course, if you identify, say, a pill, just say there's a pink pill that's got a wombat on it, and it's identified as having N-methylpentylone in it, so a nasty substance that's poisonous. You can put out a message either on screen, the big screen or big screens, or through social media, warning people not to use these pills. Now, that does not mean that all those pills are going to be the same, but it means that you can at least minimise the potential harm to people who haven't come for testing. When they see the picture and go, oh God, I've got 10 of those. Okay. So there are additional benefits and ways of getting that information out. As an example of this, in the Netherlands, there's a very good drug test, it's been there for about 23 years or something, drug testing situation. You can actually just post your drugs in to be tested. So you post them in, you get them tested, and they identified a batch of pills. So they had 5, I think, cases of a particular pill which was absolutely toxic. So they sent out a message very effectively through social media, through local advertising, etc., saying, do not take these pills, they contain methylphenidate. The local people did not use them. The drug market responded in a very effective manner and sold those pills in the United Kingdom instead, because nobody in the Netherlands was buying them. And as a consequence, a number of people died in the United Kingdom. Now, that is, tragically, a very great example of the effectiveness of drug testing, in fact, because it influenced the local market. Of course, there was another market that was out of control, if you like, that it obviously had no impact on. But it was very effective by snowballing the information out to people, preventing harm at a local level.
The question raises a really important issue, and that is how do you actually design a study of this? I said before, it's been going on since the early 1990s and the evidence isn't very good. And that's because this is actually quite a difficult study to design. It's illegal behaviour. People will not give information on the record, or you wouldn't want them to because they would be at risk. It's very difficult to follow people up to see what the actual hard endpoints are. You can count how many ambulance calls there are to the festival and compare that with the historical alternative or comparable festivals. That's one way of doing it. But mostly, and this is what Groove and the Moo has done the last 2 years, is ask people how they would respond with scenarios. So that's one way of doing it, but obviously that's not an outcome study. It's not a sort of clinical endpoint study. And you can also test whether, what people say once they actually receive information. So, for example, in those 7 cases where they identified N-ethylpentylone, everyone said that they disposed of their pill. So again, that's not 100, unless you can actually test that. So designing the studies is not a trivial issue, and probably it would require some level of agreement with the police or whatever, or the government, to enable it to go ahead.
Question in the middle, and then we've got a couple at the back.
So just for my own understanding, I'm just wondering if you have knowledge about whether the deaths related to pills are overtly due to toxic substances being present, or is it due to overdoses of substances that people are intending to take, or other things such as serotonin syndrome because of polypharmacy? Do you have the relative risk about what is causing the vast majority of deaths? Because I've tried looking at this before, and it just seems there's not much evidence or epidemiology on what's actually causing deaths.
Yeah, look, it's a good question, and I personally don't. And certainly the more recent deaths that occurred in Queensland, I'm not sure what the cause of the death was. So there were 2 people who died in the same tent in Queensland. And whether that's because they actually took something like fentanyl and died of opioid overdoses or not, I've got no idea. So obviously that information ultimately does become available, but I'm not sure how we get hold of it, in fact.
And I don't know, it's not my area of expertise, but the kind of rumours around these sorts of things, like the people in the tent, suggest, and I've got no idea of knowing if it's true, that heightened police surveillance means that people tend to go into their tent and take all their medications all at once, and that could potentially increase the risk of overdoses. I don't know if that's true, but again, it just shows how difficult it is to gain the information. How would you ever find out if that's actually what happened in a case like this?
Question.
Acknowledging the complexities of designing trials around this, and presumably the time frame it would take to roll out enough trials over enough music festivals to get a result that you can then work with to push things through in a political way, I struggle to see in a risk-benefit analysis where the risks are. And
the risks of what?
The risks of putting pill testing in place. That where the real risks to people are. I can see some complexities around policing that you've acknowledged, but on a risk-benefit analysis, it seems to have a lot more potential benefit, not proven potential, and a less significant level of risk.
Look, I actually agree with you, but I think and I'm not being rude to you because I just feel that's probably, it's a bit oversimple for the Australian context. I actually agree with you. I think in terms of harmonisation, there are so many things that we could do. Let's go talk about needle and syringe programs in prisons. There are some risks associated with that, but what are they? The risk that you might get stabbed with a clean needle as opposed to a dirty one. I mean, for heaven's sake. But we still don't have NSBs in prisons. So I think, there is this overwhelming need to demonstrate safety and effectiveness. The difficulty we've got in Australia regarding pill testing at music festivals is our music festivals are pretty small. In the UK, they have 50 or 60,000 people standing in the rain, listening to music, taking drugs. Here, it's better weather and smaller numbers. So there is a real issue that if you're trying to do it at music festivals, bearing in mind that as we've alluded to, really, the way in which it's done is going to vary depending on a whole bunch of local factors. It is going to be incredibly difficult to get information. But I do think we have to demonstrate a lack of harm from it. And I think that's the challenge, but I think we do. Now, whether, how one conducts a trial, whether the trials are, you could say relatively simplistic, counting ambulance call-outs and things like that. But, we do need to show that, for instance, we're not encouraging people, well, I don't know if we can do that, but we would like to better show that we're not encouraging people to use substances that may be potentially dangerous at music festivals just because pill testing is available there. But, it's incredibly difficult. And the other issue is, it's not just about pill testing at music festivals, is it really? This is something we should have much more. If we would follow this argument to its logical conclusion, we would want drug testing to be much more available than that.
It's important to realise that in the real world, the risks that are being considered here are also political risks. I happen to be on the Victorian Justice Health Clinical Committee, and about 10 years ago we introduced the availability of condoms in prisons under a Liberal government, and the condition that was made clear to us is that it would be introduced but only so long as no one knew about it. It never got to the media, and there wasn't a word in the media, and it went through very effectively, and the Minister for Health was happy about that. In relation to pill testing, I've been in contact with the government, and the Premier wrote back and said that basically he said, as long as the police and a police association opposes it, the government is not going to consider it. And I've spoken to the President of the Police Association, who is incredibly reasonable and well informed, and he said he's been very supportive of safe injecting rooms, but he's genuinely concerned about the effect on the local community, and he thinks that's an issue that we need to consider, and that he would be very concerned about his own members, that is the police, who would, in the music festival setting, if there were these kinds of mixed messages where they were uncertain about what their role was, or whether if they were seen to be complicit with drug taking or whatever. So these are the kind of political realities. If the police association could be convinced that there were a way to do it to preserve their integrity of purpose, which I completely accept here, and the government then could accept that there was a sense of consensus in the community, it's very likely that things would move ahead.
I've asked two somewhat linked questions, and more to do with the communication of results when kind of a good result, when the drug is technically the drug that you're buying and doesn't have any impurities that you're worried about. And thinking about how you frame communicating that when the foundational message and the message that will always be reiterated is that actually don't take this drug even if we have proven that it's good. What's to stop within a system where you've kind of proven that pill testing is a good thing, and your foundational kind of ethical foundation is one of harm minimization, and so it's a risk-benefit kind of thing. What's to stop you framing all responses to pill testing to effectively say, kind of don't take it, or even to lie in all pill testing and say that we have deemed this an unsafe compound and would advise that you don't take it? I know it's a weird one.
So I think there's the overall message is we would advise you not to take the substance, but advising people as to what the content of the substance is, relatively straightforward. And I think the next bit is, well, if you are going to take it, don't use on your own, don't drink alcohol, keep reasonably hydrated. So I think, I understand what you're saying in the sense, but I mean, there's another bit you didn't ask, and that's almost like, if it's a good quality pill, what's the risk? Because the risk of a good quality pill is everyone wants one. And you don't want to be providing you the College of Physicians imprimatur to the local drug dealer. But the reality is, I mean, if you're taking a really far-reaching view, that
College of Physicians tip.
Yes, that's right. But it's like a health thing, 5.5 stars. But if you actually did come across a batch of pills that were really good quality ecstasy and had nothing else in apart from E, then actually isn't that better, so long as people don't take too much of it, than a pill that's got all sorts of crap in it? So, I mean, it's a really tricky one, but we have seen, the reason I'm bringing this up is that pill testing around the world has resulted in changes to local markets where what is being sold is beginning to approximate more to what is being advertised. And that actually is not a bad thing. If it's improving the quality of the marketplace, that is more healthy. And particularly given that ecstasy, relatively speaking, is a relatively safe substance.
I guess, can we quote you on that?
You can quote David Nutt on that. David Nutt was the leading drug advisor to the British government until he was sacked for saying something a bit like, not quite, that taking ecstasy is safer than riding a horse, which is true, by the way. But they didn't like that message because clearly it wasn't the appropriate message to give. But you may be familiar about it. There's a drug harms rating. So drugs like LSD, ecstasy are much lower on the rate of harms, if you like, or risk of harms compared to obvious drugs like tobacco and alcohol, which are near the top: methamphetamine, heroin, alcohol, etc. Cannabis, not synthetic cannabis, but cannabis, LSD, psilocybins, and ecstasy are right at the bottom of that table.
And look, there's lots of precedents too. Since the beginning of the HIV epidemic, we've said to people, we advise you against unprotected sex, but if you're going to have it, use a condom. I mean, that's a kind of similar sort of thing. That doesn't mean that we approve of people having unprotected sex, but we're giving them some advice about how they might minimise their risk. And minimising the risk is not eliminating it altogether. And that's probably gone up a notch with the availability of PrEP, which has very high levels of protection and is leading to people engaging in unprotected sex at higher levels. So that's, it's potentially problematic, but there's I think, a universal consensus that the extreme effectiveness of PrEP is worth it.
What do you think needs to happen to get the police and police association on board?
I was hoping you might have an idea.
That was our question to you.
That was our question to you. And I'll leave till you come with me. So, look, yeah, it's a challenge because at a one-to-one level, a lot of police are supportive of a harm minimisation approach to drug use. There is a recognition, almost a universal recognition, that the war on drugs, i.e. the prohibitionist policing approach to drug use, has not worked and will never work. But you cannot get the Chief Commissioner to say that, because the Chief Commissioner is a political animal. The Chief Commissioner relies on the funds that are provided to police the drug problem, to pay for their the police force. So if they turn around and say, actually, this is not the right way to do it, they're basically saying, you don't need to give us as much money as you have been, give it to somebody else. Now, that's not a message that the Chief of Police is ever going to say. So I think it's a very difficult dilemma, knowing how to engage the police, because we have to. We have to get them on side. So for harmonisation to work effectively, we're not just talking about pill testing, we're talking about a whole bunch of things. And you have to get the police on side. And that's a very difficult thing because the senior police are not in a position to say what they believe, I believe.
And I guess the key thing is that we have to adopt a non-adversarial approach here. I believe, as I said before, that the police are actually acting with integrity here, and their concerns are genuine and authentic ones. And we have to recognise that, admit it, and help and work together with them to find a way around it. So it's not really for us to say we've got the solution. We can. It's, you know, what we should do is to say, look, we realise there is a problem. Can we try and brainstorm some possibilities? And that's how I think we should move forward.
Just on that point, was reflecting based here in Victoria on some concerns that I had heard in a different forum from Ambulance Victoria about the difference they perceived as sort of expectation on how they delivered care outside of musical festivals or big gatherings. And I think often at these sites, the onus is put on the music festival organiser to arrange private medical services, perhaps private, first aid responders within the fence, and that there was at times conflict between how patients were handed over in terms of care from those private providers who may have different incentives and not different incentives, I think they still want the right thing for the patient, but they have a different master, if you like, and Ambulance Victoria, who in how they operate elsewhere. And I wonder whether there's a similar kind of concern from police about, almost there'd be a different set of rules inside and outside the fence, and whether that would leave police feeling exposed. I don't have any
I think
but
that's
I know
true.
it's a not insignificant concern for ambulance. Yeah.
I agree.
Maybe the key is to changing drug policy to decriminalise personal possession, and then we wouldn't have the challenges that have been raised in this area.
Yeah, we're almost out of time, I think, but why don't we just... How late can we go?
Should we see if our next speakers were here?
The next speakers are here, but we can probably go another couple of minutes if anyone has
Two more
final questions.
I was just wondering for context, what's the current policy around safe injection rooms for police, and what you've alluded to some concerns about safe injecting sites in Victoria and with community. Just wondering if you could just expand a bit more on that.
So the safe injecting rooms, it's a bit like reproductive health clinics. There's a sort of, not so much a no-go zone, but there's an understanding that I think 150 metres or something, I can't quote exactly in terms of the MSIC, but around about 150 metres, the police tend to leave people alone unless they're doing really antisocial
and
things.
Specific legislation. Yeah.
So Fiona Patton actually led or got that introduced some time ago now, yeah. And in Sydney, I think it's pretty similar. Yeah. So one more question?
Oh, sorry, does anyone else have a question? Because I know I've already...
Go for it.
I guess I don't have an answer, so I guess I'm wondering, but what would be things that the police association would value? Would they value? I mean, there's always funding for certain things, there's money, but would there be particular data that they could get out of this, or particular information about the drug scene that could be valuable to them? And I guess also, has there been benefits from the supervised injecting space in terms of policing that could be applicable? So two questions, I suppose.
So in terms of the first one, I mean, my belief is the best thing to do with the substance when it's handed over, the bit that is handed over, which cannot be handed back again, is rather than disposing of the extra, is that goes on for formal testing, because sometimes formal testing takes up to about a week, if you're looking for everything. Then that's useful to inform drug markets. Now, there's other ways of informing drug markets. You can do wastewater testing at festivals. You can find out all sorts of stuff in that sort of more forensic capacity, time separated from giving advice. So I think it is helpful where societies have drug testing that's more widely available. So you put your pills in the post, send them off to be tested, etc. You can use that to inform on drug markets, if you like, to identify what substances are commonly being used and what postcodes, etc. So that can be helpful. Yeah. The second part of the question, sorry. Forgot what you asked.
So yeah, I suppose, I was thinking in terms of what might be useful for policing purposes, and have there been benefits coming out of other things such as supervised injecting in terms of, improving the environment for the police or providing them with useful information about drug availability and networks?
So, one of the questions, so I think, I can't answer that specifically. I think the big issue, particularly in Melbourne, is that the MSIC is oversubscribed. So they have over 200 people a day going through, around about 200, 220. with a facility that's just overcrowded, and as a consequence, people are heading there but not getting in there and using in the streets outside. And so having started out, I guess, in quite a positive way, with not a lot of civil disobedience in the street and the streets being a bit tidier than they were, things have really deteriorated quite significantly. There was an article that Nico responded to just last week, I think it was. So there is I guess, an increased problem because there's more dealing. Well, there's a lot of dealing around there, but I think there's probably more dealing around there now than there was. And there's a lot of substance use around there when, in fact, everyone thought that was going to decrease because they'd be using inside. But when the new facility opens in 2 or 3 months, we might see a significant change. That would be great if that's the case. And that would then allow things to settle down.
And look, it's another great question. I just repeat the point before about how this shows how important it is for us to work carefully with the police, not just to solve their problems, but also to design the study in a way that would actually deliver information that would assist law enforcement in going about their business appropriately. I think that's it.
Did you want to finish by repolling the room?
So, how many people here? So, how do we ask the question?
Those of you who were sitting on the fence politely, have any of you changed your minds?
Or has anyone changed their mind about any substantive issue relating to pill testing as a result of this wonderfully informative question and answer session? How many people found this useful? How many people found it a complete waste of time? Okay.
Join me in thanking our wonderful speakers.